Hello everyone and happy 2023. So we have Mr. Andy Villa back because he's going to tell us everything about what is going on for 2023. How are you today, Mr. Andy?
I'm doing great. Happy New Year to you and to everyone out there.
That's wonderful. And I see that you have a lovely, beautiful lady with you.
Yes, this is Jimena Perez de Leon. She is the Chief Operating Officer at Comprehensive Home Health and Hospice. So she's basically in charge of all the services that, both programs provide.
And I understand that you are the CEO of both companies, correct?
Yes.
Well, tell me a little bit about the first company. Let's talk a little bit about your first company, which is the company that we talked about in the last show.
So the first, we have two programs, right? One of them is home health. So home health services offers an array of interventions to get individuals healthier, right? So, we offer skilled nurse from RNs and LVNs. We offer speech pathology therapy. We offer occupational physical therapy. We focus on wound cares. We focus on, making sure that they get healthier and stronger so they can become independent in their lives again. So that's home health, right? We have an amazing team. We have partnerships with area hospitals and doctors' offices that send us referrals. We take care of you. We want to make you stronger. We want to make you more independent, and we want to make it to where you don't need us anymore. And our number one goal, besides getting you better, is making sure you don't go back to the hospital, right? And that's our focus with home health. We cover Bexar County and the surrounding areas. We've been around since 2011. So we've been around for going on, 12 years? And we have been extremely successful in achieving very good outcomes for our patients.
What has been the best experience that you can tell me about a family that you have helped, that you have continue helping? Because I know that you guys is a process, correct? Mm-hmm. So you guys come to their homes, you guys follow everything, you guys make sure that they don't go back to the hospitals. Mm-hmm. But tell me a successful story. Well,
we had a family one time come, they were referred, to us from the hospital. They had just, moved to this country. They had no health insurance. They had no money. The patient had been diagnosed with cancer. He had surgery. So they called us and asked if we could help. So we provided the patient and the family services for 60 days. We gave him the therapy that he needed. We gave him, wound care, after surgery wound care, treatment, nursing skills that, that were prescribed by the physician. So we provided those services pro bono, meaning that we didn't charge the family because they didn't have the means to pay. And they were very grateful for that, and that was that's a good feeling. So we try to do that every now and then, not always, but we try to help whenever we can. So that's one of the situations that I can think about that was a really proud moment for us, because the team came together, the nurses, the therapists came together, all of them committed to helping this family because they were going through a hard time and they didn't have health insurance to cover the services.
Those are the kind of stories I love to hear, because I know that you do so much for the community, and I know that you support a lot of the families, and I know for a fact that your company is that kind of company that goes one step further. Mm-hmm. You guys just don't stop and that's it, and you just try to get rid of the patient because insurance or not insurance.
Right.
So that's the beauty about it. All right, so let's talk a little bit about the insurance companies. How does that take place in your company?
So when it comes to home health, mm-hmm. we take a variety of insurances. Of course, we take Medicare, Superior Medicare, Molina Medicare, private insurances like Blue Cross Blue Shield, TRICARE. So Medicare pays for 100% of home health services. Other insurances, private insurances, pay about 80%. So the patient is responsible for 20, and the company pays, the insurance, pays for 80%. Kind of like when you would go into a hospital. We check your eligibility. Once we get the referral, we check your eligibility. We contact the insurance companies, make sure that everything is okay, and then we schedule the admission and go from there.
All right, so tell me a little bit about your experience working with Mr. Andy for the past few years.
It's been a great experience. I've been with Andy before he even started with the home health part of it. And just, being from the beginning, being part of the team, from getting licenses and getting, in network with insurances and all that documentation and the, paperwork basically, to see it the way it is now, how we've grown the team that we have together. It's an amazing team for both companies.
And I do understand that you are from Mexico.
Yes, Mexico City.
So tell me a little bit about yourself.
I was born in Mexico City. I came here when I was about 14. My dad opened up a business here. We all moved, my family and I. And I've been here since. I went to high school here, college here, master's.
So the beauty about it is that everyone speaks Spanish at your staff, correct? You have some Spanish.
A lot of our staff speak Spanish. Yeah, I would say everyone, but mostly everyone speaks Spanish.
Yeah.
All right. So
And when it's complicated Spanish, we call him in.
Jimena is there for us for the complicated Spanish. That's wonderful.
Absolutely.
Well, that's a good thing to know. And I think that next time, Mr. Villa, we're going to have just an entire 20-minute education about insurances. Because one question that has been brought up to my attention is, how do I choose the right insurance? I think that's an important topic because I think that people need to be able to have choices. But most of all, in order for you to have choices, you have to understand what insurance do for what. And I know that some of these companies, they try just to sell a policy.
Yes.
But they try not to educate you. And then when you try to go get certain services, they're not covered.
Many times it's not the best for you.
That's right.
Definitely.
That's right.
We have experiences, and I would love to come back and talk, about, insurances and, what to look for and not look for. And, because everybody's needs are different, right? So you have to look at all the different plans and different policies. But one of the things that people really need to be, alert about is sometimes insurance will be like, oh yeah, well, you're getting services like comprehensive. Oh yeah, I mean, home health, we cover home health, don't worry about it. Or you have, Dr. Garza or C over there. Oh yeah, this insurance covers all your medical needs. Well, they might cover your medical needs, but if your home health agency is not in network with that agency, we can't accept you. And if you're on our services and you change insurance, we have to discharge you. If you have Dr. X over there that you see and you've been seeing for 20 years and you all of a sudden you get on an HMO plan or that doctor's not in service, then they're not going to pay for that. So you really have to be careful and look at your needs, who your doctor is, what hospital you like going to, what home health services you like the best, and just make sure that those people that are providing you with care are in network with that insurance, because they're going to tell you, oh yeah, don't worry about it, we got it covered. And a lot of times it's not.
That's the reason why I brought that up, because I really do feel that for 2023, we all need to be insured. But I think it's very important for us to make the right choice, to understand.
The right
How
question.
do you cover it? Not just do you cover it. Something that happens to us in home health very regularly is the insurance says, yes, we cover it. But what they don't tell you is they only give you 25 visits a year.
Yeah.
When you have a wound that's not closing, that's nothing. That's not enough time.
Right. Or if you have a stroke and you need therapy, or you're in and out of surgery, or you're in a car accident with multiple surgeries, multiple wounds, and 25 may not be enough. So asking the right questions, I think it's critical and paramount, in getting the right type of insurance for you.
I would be that first one to be sitting down here with you guys, and I want you to educate me about what is the best insurance, because I have a lot of people that come up to me and ask me, because they're trying to get directions. And as we all know, San Antonio right now happens to be the third fastest growing city in the entire United States of America. So we have people moving in here faster than we can blink our eyes. So I think that education is important, but your business is very important and is precious. Why? Because you could save people so much money by not being at a hospital and having that home care. That home care is so important. And I can relate to that because my mother, had 2 open heart surgeries. And it was to the point that it was so expensive, even though she had good insurance and everything, but it gets very expensive. So towards the end of her life, we put her at your service, at home care. where someone was doing that home care at home, and there's nothing more convenient than being taken care of at home. So let's talk a little bit about the other services that you do have, which is the hospice.
Okay, so I'll let Jimena take the lead on that.
Our hospice, the main difference from home health is that it focuses on quality at the end of life. And it encompasses a lot of different things. It's not just, of course, the main part of it, making you comfortable, taking care of your pain, taking care of your needs, nursing, spiritual, social work. The team comes in. We have a medical director and staff. He oversees all medications, all medical treatment. Not medical treatment, I should say, to make you comfortable. I'm sorry. Right. Something that's very good about hospice is that, again, it works with the patient and with the family. So it not only helps the patient come to terms with their situation, but it also helps the family, which many times, the patients are ready, but the family is not. And you have a patient who's trying to fight because their family wants them to fight, right? And we have a social worker. Our social worker is amazing.
Yeah,
our chaplain is amazing. Our nurses are amazing. And they really come in, and I've seen how families are struggling, and there's conflict between them, conflict within themselves. And by the time, give us a month in there, or weeks sometimes, because that's the only time we have, everybody's at peace. And that individual is able to be at home with their loved ones in peace, and with somebody who's helping them through pain, through medical conditions that are very difficult.
It's a process.
Right. Well, because the patients that we have, their moms and dads, their grandmas and their grandpas, their aunts and uncles, and their sons and daughters, right? So it's really hard to let somebody go.
Oh, yes.
Right. So I know that sometimes we talk about hospice, and it's like, oh, because what hospice is you have to have a diagnosis, a terminal diagnosis, and you have to have 6 months or less to live in order for you to qualify for hospice. You're in the hospital, doctor comes in, tells you and your family that you're end of life, and they're recommending hospice. It's a lot to absorb, and it's really difficult for the family sometimes. So again, I think that the team that we have in place helps them through that journey. And we have an amazing team. As we're talking earlier, one of the great things about hospice is that we, even after the patient, passes, we follow up with the family for a whole year. In case they need counseling services, mental health counseling, we are able to either provide it or link them to community resources where they can get the services that they need.
Now that's what makes you different. I heard, that your services are first class, and it's because of the staff that you have. You have such a very well-established platform that you know exactly what to do, and I can relate to everything that you're saying because I'm from Alaska, and when we had to put my mother at hospice, it was a good company, and that gave us that comfort because they knew exactly how to deal with everything, because everything is about emotions. But it is very, very hard, and no one's ever prepared for this, to see a loved one go. It's very hard. And sometimes life catches us by surprise, and we don't know what to expect. And so companies like yours are important because you guys have that platform down.
I understand exactly what you're saying, because both of my parents passed away with cancer. My dad passed away with non-Hodgkin's lymphoma, and my mother passed away with pancreatic cancer a few years ago. And we had hospice services, right? And you really don't know how important those services are until you're there and you need them. And we had, with my father, we had an amazing hospice company that was there to the very end. They guided us, they provided us, the support that we needed. Same thing with my mother. And it made a big difference. It made a huge difference. Nothing can prepare you to, when losing a loved one. But they can make the journey a little bit easier for you. So, on a personal note, we make sure that our team understands that we need to provide top-notch quality care with compassion.
And one thing that you said that I thought it was very important is that you just don't go and take care of the loved ones while they're just needing you. I mean, you follow up a year, complete year with that counseling. Because, the biggest problem that we're facing today is that there is some people that they put themselves, go through the depression. And when they go into this depression, they go into this medication, getting hooked into different medications. And people need to understand what is the differences of your services right here,
Right.
Andy, because what you are offering, it's the full bundle here. It's the home care and it's the hospice.
Right.
So those are the two different things that we're talking about right here.
And sometimes our patients transition from home health to hospice.
I was going to say that I think something interesting that we have to offer is that we are housed under the same administration, right? We have had patients that, they just don't heal. So
Right.
eventually we transition them, they keep the same staff that the family and the patient are used to. It's a continuum of services. It doesn't have to be a break. So to them, it doesn't really feel like things change so drastically.
Right.
To them, it feels like home because that's where they were getting services before.
Yeah, because they get to keep their nurse. They get to
yeah.
keep their home health aide. They get to keep, if they need therapy,
therapist.
they get to keep their therapist. So there is a bridge. Because sometimes, we get patients in home health and we want, and we try really hard to get them back on their feet, get them independent again. But sometimes their health declines and, we have to have that discussion with their doctor and the family about transitioning to hospice. So it's a seamless process, right? There is no interruption of care between one and the other.
Yes.
And I think that one thing that sets us apart from our competitors in hospice is that, we're locally owned. We're not a big corporation where we have levels of bureaucracy. We make the decisions, right then and there. We provide care 24 hours a day. We do admissions 7 days a week. It doesn't matter if it's a holiday.
But the most important thing is that you always have a plan. You always have a plan moving forward. That's why you're successful. What is going to be differently this year that you didn't do in the previous years?
So, comprehensive home health and hospice, when we talk about the home health, there's a few things. So right now, a few years ago, we got a certification for infusion therapy. So we provide infusion IV therapy at home. So we want to expand our marketing efforts to make sure that everyone in San Antonio knows that Comprehensive Home Health and Hospice is a certified infusion therapy company. So that's one of the things. And hospice, what we want to do is we want to expand our geographic area to maybe include more patients in Bernie, more patients in New Braunfels area, and expand. Now that we were in San Antonio, we have all our systems in place. We're comfortable and confident that we will be able to expand our care in the area and continue to provide quality care, right? So we want to grow, but we want to grow strategically. We want to grow in a smart way where growth is not going to mean that we're going to lack that quality of care, right? So we want to do it in a smart way. So we continue to grow, but we continue to provide good quality care. One of the things that I think that it's really cool that we do in home health is we use technology with our wound care. Did you want to talk a little bit about tissue analytics?
It's an app. It's called Tissue Analytics, and it's amazing. And basically what it does when we have a patient with a wound, there's, the measurement and the assessment of the wound can be very subjective at times. And what this does is the nurses just basically use a little green dot and they take a picture and they upload it into this program. And the program measures the wound for them.
So they put
put
the green dot right next to the wound.
To the wound. You take the picture and it measures. So it tells you the width, the length, and then it tells you also the type of tissue that you see in the wound. And, without getting too medically, you have different types of tissue as it heals. And what it does, that team has wound certified nurses that work for us, the pictures that we upload. So once the nurse uploads a picture, they kind of put a little background, what they see, things like smell, things like that. And then the certified wound care nurse will give advice and say, okay, this is what I'm seeing, it's healing well, continue. Or they will come back and give feedback and say, looks like it's not healing as fast as we would like it to heal. These are recommendations. We can come back to the doctor, give them the reports and say, look, we don't think it's healing. Do you accept the recommendations? What do you recommend?
What can we do differently to make it better?
What can we do differently? It's
And
amazing.
the cool thing is when you take the picture of the wound, it automatically uploads into their system because we're going through the app, and the doctor has real-time access to it. So the second that it's uploaded, our director of nurses can see it, I can see it, Jimena can see it, and if the doctor wants to see it, the doctor can see it as well immediately. And we do that once a week to all our wound care patients.
And you get not only real time but historical data,
Yep.
which I know I've personally spoken to doctors and they're like, show me. And I can say, this is how we started, this is where we're going. And that is very useful because they can see how the wound is progressing.
And sometimes people wonder, well, how hard is it to measure a wound? Well, it's very difficult because wounds are not a perfect circle, and they're not a perfect square, and they're not a perfect rectangle. Wounds are all over the place. So studies show that nurses make errors in measuring the wound 60% of the time. This is over 90% accurate on measurements, which is really benefits the client. We're one of the few agencies that uses that technology in San Antonio, and it's been amazing. We've gotten very good health outcomes.
Wow. So talk about getting technology involved in your companies. You know, it just makes it easier, better. And isn't it amazing how it's like you know everything exact?
Right.
I mean, that's the beauty about it.
Yeah, and it's very important too, for supplies. The companies that make the wound care, devices.
Yes.
They call us every week and they say, I need measurements. So there's no guessing, there's no calling nurses to, open the
Right.
app. These are the measurements for the week and we know they're accurate. They
Right.
can send the right supplies, they can send everything. It's great.
And one of the things that we do is we teach, if the family's willing to learn, we teach the family, their caregivers, how to treat the wound, when we're not there, or if we have to discharge and, for some reason, we teach them how to treat the wound, the importance of, infection control, wearing the gloves, washing your hands. We take because what happens is we're there 2 or 3 times a week, but the rest of the, 3 to 4 days that they're there on their own, we want to teach them not to expose that wound to infections or bacteria, to wear the gloves, to wash your hands, to, make sure that, if you have pets, that they're away from the wound. It's that kind of education. I think it's extremely important, and that helps keep the patient out of the hospital, and it helps the healing process.
Well, that's the most important education. Like I said earlier, people need to get educated about insurance.
Right.
Because we all have to have insurance. I think it's very important to have insurance, but we have to understand what is the system of the choices that we make when
Right.
we go get insurance. So I
Right.
think that we need to just do an entire little workshop on that because I think that's important. And I also would like to extend everyone to know that Mr. Endivija is going to be having trainings through the website, correct? For your patients. So we're going to go ahead and put together some workshops that we're going to create so that people can feel comfortable to just go online and get educated, so that way they don't feel like they have to go to a location. They could just be doing it right out of their home.
So what we want to do is once we, redo our website, is we want to have educational videos on there, information, not just on insurances or, different kinds of, nutritional training videos for people who are diabetic, exercise, videos for people who may need physical or occupational therapy, talk about wounds, talk about infection control, talk about exposure control, things of that nature. So, in 2023, as we're talking about what is it that we're going to do, that's one of the things that we're going to do as well, is work with you and make those videos and upload them on our website. That way people, if they want the education, if they want the information, it's a click away.
It's a click away. Well, Mr. Endivija, that's what makes you different. You are on top of the game. You are definitely the kind of business owner that cares. And it shows. It shows by the love, by everything that you're putting into, but most of all, by having the right staff that are going to be there supporting everyone 24/7, 24 hours, 7 days a week. And that's a comfort feeling for everyone. So that's what makes you different. What makes you different along from everyone else is the fact that you care. You care that you have the staff. You're growing slowly surely, and it's about the quality, not the quantity.
Right.
Absolutely.
And I love that.
Yep.
I love that. So I want everyone to understand. Mr. Villa has 2 services under 2 different umbrellas, but at the end of the day, it's all in one umbrella.
Right.
I want everyone to understand that because I don't want people to get confused.
Yeah, so we are comprehensive home health and hospice, and we have 2 programs. One focuses on home health, and one focuses on hospice. And we like to cross-train our staff, right? Those that are interested in both, we cross-train our staff to make sure that there's always somebody available to treat. But yes, you're right. We have 2 programs under one umbrella. And the good thing is that we're both actively involved, and like I said earlier, Jimena does all the day-to-day stuff, from training the staff to hiring them to get everything ready, and it works well because, we focus on one program and then we turn around and focus on the other program, but the systems in place for quality assurance and and monitoring and tracking and assessing outcomes, our systems are the same, and it works well for both programs.
So there are both programs under one umbrella, but they're beautiful because they go hand on hand. So for everyone watching this show, it is important to contact.
You can contact Comprehensive Home Health and Hospice at 210-614-0200, or you can visit us on our website at www.chh-sa.com.
That is so wonderful. Okay, Mr. Villa, what message do you have for everyone out there listening to this interview?
So I think one of the most important things that I want everyone to know and understand is that you have an option. It is your choice. Medicare, the insurance companies make that very clear. You have a choice. So do your research, regarding the companies. Look us up. We have an excellent reputation. We'd love to take care of you and your family. And if you come with us, you know that you're going to get top-notch quality care.
And that's why we are here today, because we are about caring, quality, and most of all, about answering all your questions.
Right.
Information's right here, so don't hesitate to visit. It is very easy to just pick up the phone, make that phone call.
That's right.
And get your concerns, your questions answered, because there's no better comfort, right, Jimena, than having all the answers right there at the tip of your fingers.
Right.
Absolutely.
Well, thank you so much for this wonderful opportunity again to have you back here. And, just to let everyone know, now Mr. Villa is big in technology. You guys are getting better and better, and we like that because everybody, technology is growing faster than, we can keep up with it.
Right.
But the most beautiful thing is that we have the support.
Right.
So we could, get trained, and now things are just going to get easier for all of us.
Right.
Okay, and I also want to cordially invite everyone that Mr. Villa does have a podcast, and obviously the podcast is going to be all based about educating you based on home care and
Hospice.
But the most important thing, also we're going to be having some talks about how to stay healthy.
Yes.
Am I correct?
Yes, ma'am.
Thank you so much, Mr. Villa.
Thank you so much.
Jimena.
Thank you.
Thank you. Hasta la vista.